Now we have Boston's finest, Democrat from Massachusetts, Congresswoman Ayanna Pressley. Oh, Congresswoman Pressley, you don't look like what we've been through because I know you fight. You a fighter. You don't play. Talk to me. I know the biggest issue has been health care, and Congresswoman Adams touched on it. Talk to me about that because I understand that that was an issue that Hakeem Jeffries was going to talk to the president about when the first meeting was canceled, and he must have talked to him about it when they had the meeting because he Trump made an AI putting a racist AI for Hakeem Jeffries, putting him in a sombrero.
Right. Let me just say something, April. I feel like people are watching from home and they're frustrated.
Yes.
They have a lack of trust in their government, a deficit of hope. And sometimes they might just be wondering, why can't those folks just get it together in DC? And I need to just say that I don't know a Democrat that is not willing to sit at the table and work with anyone in the name of the safety, health, well-being, and welfare of our shared constituents. The fact of the matter is, the Republicans are very unserious.
Mm.
Here, Donald Trump is, at that time of those negotiations, on the brink of a government shutdown, which will compound the harm of the big, ugly law that took healthcare away in the form of Medicaid from some 15 million people. Now, April, there's plenty of people that will say, well, I'm not on Medicaid and I don't feel the impacts of that. Well, the thing is, you do feel the impacts because your hospitals and your community health centers and others rely on those Medicaid reimbursements. And so whether you're on Medicaid or not, somebody you love, work with, or worship with is likely on Medicaid, and it felt the impact of that denial of 15 million people, and then cuts to SNAP. The supplemental nutritional assistance, food stamps. That's just $2 a day per meal, April. So, and then when you layer that with these fiscally irresponsible policies, these chaotic tariffs, the chaos and the unpredictable nature of governing under a Republican majority, people are already hurting. Inflation, and now this Republican spending bill. So again, April, they talk about lowering the temperature, but you're not lowering the temperature when you dig in on partisanship and choosing loyalty to Donald Trump over loyalty to the people who sent you to Washington to do a job. Negotiation means we both get something that we are fighting for. And the fact of the matter is that this Republican spending bill only doubles down on the hurt and harm and means to create more harm. Because if you are insured, now I represent a district, April, that is one of the most unequal in the country. From Cambridge to Roxbury to Nubian Square, the blackest part of my district, life expectancy drops by 30 years. So this is one of the most, unequal districts across all outcomes, but including and especially health outcomes.
And let's let people know Cambridge has Harvard, Harvard,
Harvard,
Harvard.
MIT, right? So from Cambridge to Roxbury, a 3 mile radius, life expectancy drops by 30 years. So my district has some of the most disparate health outcomes in the country. And again, felt the harm of and hurt of the first Trump presidency, of the pandemic, was hit the hardest, and now is feeling it again, doubly so. And so what we're saying is for people who are insured, because I represent a lot of people that are uninsured, but for people that are insured, they stand to have their health care costs go through the roof. So to double in costs, by some $700, $1,000. Imagine that, April. And so if you see a healthcare bill double and just go through the roof, and now you're having to choose between healthcare and groceries and rents, because we know the rent is too damn high, a lot of people are not going to choose their health care. And what that means, April, is that people will get sick. People will go undiagnosed.
Yeah.
People who already are managing pre-existing conditions will not get the health care that they need. And that's why Democrats are holding the line,
Yeah.
because this is a fight worth taking on.
But I want to go even deeper with this healthcare thing. When people are not getting diagnoses or treating illnesses, I'm thinking about something the late Colin Powell said when he was Secretary of State, when we traveled to Africa with George W. Bush, and there were health crises when it came to things like HIV. And he said, when you don't have communities that can stand up, if there's some kind of military issue, that's a national security crisis. If you have people, veterans, if you have veterans, military, the general population that are sick, and right now we're in COVID and flu season, what
And
happened?
so we won't talk about, the efforts to deny access to essential immunizations and vaccines. So the
Ooh,
point being here, April, is that our greatest wealth as a nation is the health of our people. Our
yes.
greatest wealth as a nation is the health of our people, and that health is being threatened every day by this hostile Trump administration. Have we ever had a president? Now, listen, there are plenty of presidents that I've disagreed with policies, and we spent, as particularly as Black Americans, decades digging out from. But this is a president who actively has contempt for the American people. He is at war with his own people, and then he makes light of the fact, threatening and playing games with people's lives as he so often does. Well, I'm just going to fire a bunch of people. The fact of the matter is, under a shutdown, federal workers have greater protections. But the truth of the matter is, April, if you think about day one of this administration and the reckless actions of the so-called Department of Government Efficiency, those reduction in forces, those mass unlawful firings, Donald Trump wants to privatize the federal government. So this is, this is what he's always wanted to do. And I do want to just share a note from a federal employee, okay?
Please
Because,
do. Please
and
do.
so what they said is, thank you for holding the line. I receive calls daily as a federal employee asking if I'm okay. And
Wow.
truthfully, we are. It is a much needed break from an incredibly chaotic and challenging year. Colleagues being fired and now left to tell schools we're stretched so thin we can barely support you. Thank you for holding the line. Going without pay is a small sacrifice for the greater good of ensuring that more Americans are supported once we reopen rather than being left behind. Now, I want to center that, April, because every federal worker that I know that was a collateral damage of the first actions by the so-called Department of Government Efficiency, many of them Black women, because we're 12% of that federal workforce. Usually it was a Black woman that was processing that FAFSA application at the Department of Education. It was a Black woman enforcing fair housing laws at Housing and Urban Development. It
Come
was a
on.
black woman when your grandmama got played by some scam that got her justice at the Consumer Financial Protection Bureau. It was a Black woman doing the work of USAID around the globe, exercising that soft power of humanitarian aid and relief, combating disease, hunger, and malnutrition. So it was a Black woman in Health and Human Services, doing the work of Head Start, and providing that critical care. So those workers that I've spoken to, they were not concerned about the disruption of their livelihood and lives. Their first concern was of the work that would go unfinished,
Yeah.
because they are dedicated public servants and patriots.
Yeah.
And Donald Trump wants to play with them. He wants to play with their lives and their livelihoods and their ability to provide for their families. They are the true patriots. I don't know about that fake bravado of Pete Hegseth. These are true patriots. And so even in the midst of the critical choices before us right now, and they're saying, hold the line.
Mhm. Well, I want to say this. I mean, you always come with receipts, and you just did you just showered us with them. But something that you also said, you talked about, I want to go back a minute to healthcare. One of the reasons why Barack Obama created the Affordable Care Act, better known as Obamacare, that he embraced, he said, and Valerie Jarrett, all of them said, is because he wanted to make sure people could stand up. He wanted a healthy workforce. It was cyclical. It was a wholesome uh, approach. It was a full circle approach to trying to help the workforce and keeping people healthy. And now,
Mm-hmm.
because it bears his name, you have
Mm-hmm.
a president who is very jealous and who doesn't want that to happen. And also,
Yes.
when you talk about these Black women that were in these jobs, since February, 900, no, excuse me, 300,000. Why am I getting
Right.
nines and threes?
No, I
300.
got you. That's an issue I'm leading on. So, yeah, 320,000 Black women from from February to August have been
Mhm,
pushed out of the public and the private sector because what you're talking about is not only the degrading of the federal workforce,
mhm.
but you're also talking about the dismantling and defunding of diversity, equity, and inclusion. So in the private sector, Black women, many of them have been the CEOs of DEI work in the private sector.
Yes.
And then also, this means a less representative force in the private sector because there's been a chilling effect and people are rolling back on those commitments for DEI. And so,
Mm.
April, this is devastating for Black women, for Black families,
Yes.
and Black futures. Overall unemployment is at 4.3%. And for Black women, it is at 6.7%, which is why I've been calling on Chair Powell to analyze the data and come up with a meaningful plan because they have a statutory mandate of maximum employment. That is their job for all people. But April, this is Black women are so often, we're the canaries in the coal mine.
Yes.
We are bearing the brunt. But make no mistake, this harm will come for everyone. And
Yes,
that
it
is why
will.
I'm calling on them to come up with a plan because it's coming for Black women now, but it will come for everyone.
So I want to go to our chat because people are blowing up our chat. They said Black women, Becky says Black women have taken the biggest hit just when they were starting to get a step up into the American dream. Helen says our babies deserve so much more than this evil, cruel, and stupid politics. Catherine, thanks, Representative Presley. It helps to hear about the Fed workers. John says that's a beautiful letter. There's a question. Time to realize they are trying to cull out sick and elderly, or as cut out sick, elderly, and poor. Carol says the cruelty and the chaos are their objectives. Map says, ladies, please stay in the game. Catherine says hospitals have been closing already in rural areas. Yes, they have. Leanne says, does Trump want to destroy the economy? Yes. Um, Jen says, yes. We need to be fighting against all this foolishness. Omar says the people want fighters. And I'm going to come back to that issue. Denise, beautiful spirits for the good. Katie says, you are all wonderful. I know, especially in them hats. And Omar, we were talking about, he said, Omar came out saying, oh, I'm paying $9 for blueberries. And I said, where is it? He said, in California. That's ridiculous. And now we can't even, some people can't even go buy the blueberries. But
Mm-hmm.
I want to go back to this fight because you are a fighter, point blank, end of story, period. But
Mm-hmm.
in this fight, the the president has designated his generals to send the military into places to go after people who fight. And they will probably label us domestic terrorists for being part of democracy, something our white founding fathers who had slaves put in place. What do you say to that?
Well, look, Project 2025 was not a blueprint, it was a playbook, and they have made
Mm,
good on that and then some. Let me just say all the things they want to do. They want to fire everybody, degrade the integrity of the federal workforce, and privatize it. They want an authoritarian state, which is why Pete Hegseth pulled all those generals and folks together to get them to pledge their loyalty and their fealty to Donald Trump instead of to the Constitution, and our country. It's all about power and control. And that's what the occupation, the militarization of our cities is about. It has nothing to do with public safety. Because please look at our Black mayors who have been doing the damn thing.
Yes.
They have been very successful making those long-term sustainable budgetary investments in those things that actually do keep us safer.
Mhm.
I'll never forget, April, when I was a city councilor, and one of our most successful gun buyback programs was that you got a bag of groceries in exchange for guns. And that really just highlighted that so many people commit crimes out of the need to survive.
Yeah.
And so that when we make those investments that support people in the stabilization of their families, then you see crime go down. And so our mayors, Black mayors, have been very successful in that. So these actions to militarize and occupy cities, most of whom are being run by Black mayors, is not meant to make us safer. In fact, it's creating terror that for me is very
Yes.
reminiscent as a Boston congresswoman of Boston in the wake of Charles Stewart and what happened in Roxbury with racial profiling. It is
Wow.
very it is very familiar. This is meant to intimidate and to control and not to make any of us safer. And when we stoke that terror, it makes all of us less safe, April. So
Yeah.
this action that they want to put into motion to use our cities as training grounds, to me, it's straight out of an authoritarian playbook. It is straight out of Project 2025, and it is dangerous.
It is
It
very
is
dangerous.
dangerous, and we will certainly be the most vulnerable.
And a lot of these Black mayors, particularly Brandon Scott, I know very well in Baltimore, were trying to have holistic approaches to crime, and crime dropped. And now you've got these National Guard out there patrolling for no reason. But let me ask you this: what do you think about this assessment? This traveling with Pam Bundy and Hegseth and others to go down to Memphis. Um, Memphis, those people in Memphis gave them the what for. They stole the tank and then took the tires off the tank.
Mm-hmm.
My husband was like, you know what they did? I said, what? I said, Lord have mercy. But they gave them the
Mm-hmm.
what for because it's overkill.
Yeah. I mean, first of all, they need to be mindful of where they're going. I'm thinking of the Diane Nashes of the world and people
Come
who've been,
on.
trained in these cities by some of the greatest freedom fighters to ever do it. Look,
Yes.
history has shown us, April, that appeasement does not work.
Mm.
Donald Trump is a dictator, and the only way to beat a dictator is with defiance. And that is why we have to resist, we have to reject, we have to agitate, we have to obstruct at every single turn because appeasement does not work. And that's why, listen, April, I've been very critical of my own party many times about the fact that I have felt that we've often moved with scared power, and scared power isn't power at all. And I was disappointed when the Senate was not united with House Democrats with that first continuing resolution, that short-term, budget. They ceded all the ground. So in this instance, I'm so encouraged by the fact that we are united, we are holding the line. This is a fight for healthcare, and healthcare is a lifeline. It is not a nice to have. It is a must have. And so when we say that if they allow the subsidies of the Affordable Care Act to expire, which were put into place to lower the cost of healthcare, people will not get the care that they need. People will not get the diagnosis that they are in need of. If they have pre-existing conditions, they will not get the treatment they need. And people will get sicker and people will die. And already, because of the impacts of the big ugly bill, and the cuts to Medicaid and SNAP, people are hungrier, they are poorer, they are sicker. And because of this state of terror that he means to sow with the occupation of cities, people are less safe. A state of terror makes all of us less safe. And this Republican spending bill would only compound that harm. And so that's why we're demanding that they restore the cruel cuts to Medicaid, that they save health care, because if these tax subsidies expire, some 20 million people could be impacted. So you're talking about people either losing health care or if they have insurance, not being able to pay for it, those co-pays, those deductibles, and those premiums, and then just not getting the care at all. But the last thing that it's important to note is that Trump is still very focused on a nationwide ban on abortion care, which is health care. And one of the things in this says that in the Affordable Care Act marketplace, if you are a provider that provides abortion services, if you're seeking an abortion, that you cannot do that through a provider from the Affordable Care Act marketplace. And so it's another way of creating sort of backdoor bans to get us to what they really want, which is a nation of forced birth.
Well, Congresswoman Ayanna Pressley, you know I enjoy talking to you and being around you, just getting your glow and your wisdom. And I want to thank you for joining us. Next time, like I told Congresswoman Alma Adams, come back with your hat because we're going to have hot tea next time. And
Okay.
I pray, yes, and I pray next time we won't be in this mess. And thank you for your fight. Thank you for your strength. And thank you just for being who you are, because you are
April,
an
thank
amazing
you.
fighter.
The people need facts, not propaganda, sis. So we appreciate what you're doing. And anytime they come for you, we got you.
I know you got me for sure. And I know Conan's got me too. So,
Yes, he does.
well, I thank you. I
All
thank you
right.
so much, Congresswoman. Be well and keep up the good fight. And let us know what's going on, okay? Thank
Okay,
you.
we'll do.